in Detroit. So you have Lindsay and I today, and we have our leadership team on here somewhere. So whenever you are ready, you can kick us off.
Okay, are we ready to get started? Today, we only have 2 disciplines going. So first is Kate and Alex with psychology. Are you guys ready to go? All right.
All right, pull up my screen here. Okay. So, and if something you can't see or hear, just let me know. But yeah, I will take us through the assessments that I did with Jonathan last Tuesday, so a week ago. Here's a list of everything, but I'll go through each one in more detail. We did interview with mom, and then some cognitive testing. I looked at some of his adaptive behaviors, and then social emotional is kind of down here. So I will break all of these down. So started off with a diagnostic interview where I just talked to mom for about 45 minutes and just try to get a really good detailed understanding of everything that's going on. So what we learned from this was some of the things that we had speculated or already knew from the notes that we had. He's still having temper outbursts every day. It sounds like it's pretty much all of the time. She describes him as always on the go or always moving just into one thing and then the next thing. Related to school, it sounds like in first steps and some of the early intervention or preschool type settings he's been in, teachers report similar things to mom, that he's always on the go, has a hard time sitting down and engaging. And he does have an IEP for speech therapy that we did receive last week, so that is helpful. As far as trying to play with others or with his classmates, he seeks out other people to play with. He wants to play, just has some hard time following rules or taking turns. So learning to do that. Mom talked about a history of some delayed walking and crawling. And as we talked about last time, noted the difficulty with sleep, saying he'll really only sleep even with the large dose of melatonin that he has for like an hour, 90 minutes at a time, and then he's awake and kind of have to get him back to go to sleep again, which seemed very disruptive to me, I'm sure to everyone in their family, and seems like that would be really difficult. And then we talked about family history. There's family history of ADHD, some extended family members with autism, and then some symptoms that dad had. It was kind of unclear whether or not he had formal diagnoses or just symptoms related to OCD and bipolar disorder. So that was our diagnostic interview. So after that, I moved over to a smaller table to work directly with Jonathan for a little bit. And the first thing we did was the DOS, which measures his cognitive abilities. And I think the important thing here is just to keep in mind that this is kind of a snapshot of where he's at right now, but because he's so young and the way this test is, it should just give us an overview of strengths and weaknesses he has cognitively, but we wouldn't really expect that to be predictive or stable about giving us a picture of his IQ until he's older. So want to be careful and keep that in mind. And then this shows his scores from the DOS. So where I have it called out as a standard score here, so these blue ones, an average score would be 100 on a standard score. So you can kind of see where his scores fall on these bigger clusters compared to what would be like the mean for his age. So verbal cluster, nonverbal cluster. So doing some tasks where he had to name things, answer some questions, looking at new puzzles and finding relationships between things. He scored right in the average range, so that to us means no cognitive concerns in those areas. His spatial cluster, so this one here, is 78, so that is lower than most peers his age, and a little bit lower than we would expect. Not entirely sure why this was lower than the others. I will note that the two subtests that make up it, the pattern construction and copying, were towards the end of testing, and he was definitely getting tired of doing testing at that point. So it could have been that he was losing interest, losing steam. But that being said, during both of those subtests, he would frequently say, "This is hard," or "I can't do this," and he wasn't saying that in some of the other ones. So it may have been that he does have difficulty when he's kind of manipulating visual things, building with blocks. Some of that was writing. It'll be interesting to see if there are some motor things that come up with him. Maybe that's impacting that as well. So then the DOS also provides this overall general conceptual ability. So his was in the below average range, but I have that star there because there's such a big difference in the top two clusters and the third one. We probably won't use that to summarize the scores because it's just not a very good picture of everything overall. So overall, pretty much in the average range, cognitively, not a lot of concerns there, but may want to keep in mind that spatial score and see how that pops up in other places. Okay, so then we did the Bracken, and this is more about things that he's learned over time. So it would kind of be more like an academic test, but because he's so young, we call it these pre-academic skills. But has he learned his colors, shapes, numbers, letters, those kinds of things? Things we would expect someone his age to be learning and knowing about as he's going into school. So here I have, these are the subtests that he did. This first, the school readiness composite actually has 5 little subtests, and that's the color, shapes, numbers, and letters, those kind of things. And then some other subtests that ask about like direction, position is kind of like underneath, below, next to, seeing if he understands that. And then self and social awareness is kind of recognizing emotions or behaviors in pictures, understanding if I show him pictures for texture material, which one is the wet one, which one is new. So again, just some of that learned information over time. The scaled scores on this one, an average score would be 10. So as you can see here, based on his scores in the percentile rate, most things would fall in what we would call the delayed range, or would be lower than what we would expect him to know given his age. I don't know why this last one at the end came up as something he knew really well. At that point, again, it was the very last thing, and he was tired, so we had showed him some of the prizes that he could earn, so there may have been some extra motivation there. I'm not sure. But kind of taken overall, with his standard scores down here falling more, and with the standard scores, the average is 100. So these are also a little bit lower than that, or what we would say is in the delayed range. Does give us an idea that, so his cognitive ability was average, expected for age, but it's showing that his learned, the things that he has learned is a little bit lower than we would expect, given both his age and cognitive ability. So there's something there, and it might just be that he's so overactive. He has a hard time sitting down and paying attention, especially if it's not a one-on-one setting. That might be getting in the way of him learning some of these things. So after that, well, those were the only 2 things I did with him. And then I had Mom fill out a whole bunch of long questionnaires. So this first one is the Vineland, and this provides information about his adaptive behaviors. So what can he do to get himself ready, like putting on clothes, eating and feeding himself, and then looking at, so that's kind of the daily living skills. Communication, so how well can he express his needs, talk to other people, how well can he listen and follow directions, understand what people are saying to him. The socialization is how well does he interact with kids, is he playing with kids in a way we would expect for his age. And then the motor skills is really brief compared to what PT and OT would do with him, but just asking Mom, does it seem like he's running and doing things like that we might expect for his age. And this adaptive behavior composite is an overall that kind of summarizes everything else. So again, these standard scores, an average score would be 100. So mom is reporting his skills to be a little bit lower than we would expect given his age, particularly in socialization and motor skills. Saw a little bit more deficits there compared to other things. And I think now that I'm looking at this one here should also be the low category. His communication. So it might be kind of similar to the last one where he has the cognitive ability and he's at that age, but it might just be that some of his behaviors are making it hard for him to learn some of these things. So then mom also filled out the BASC, which provides information about his social and emotional functioning. And you'll see here these T-scores, so the average would be 100, but things over 65, I think it is, maybe 70, I will double check that, we would consider clinically significant. And then you can look at the percentile rate of the ones that I've bolded too, that his mom is reporting his behaviors of hyperactivity, aggression, for example, to be so high that he's within the 99th percentile. So a higher level of those behaviors than we would expect to see in most other kids his age. The BASC also has some validity indexes to make sure you are not getting conflicting information or kind of give us flags if someone's over-reporting, and everything was consistent with her reports. So it seems like this is pretty valid profile of what we're seeing with Jonathan. So that shows the hyperactivity, aggression was really high, which had this externalizing problems, scale high for him. Some symptoms of depression, and with kids that can a lot of times look like irritability, which we might be seeing with some of that hyperactivity and aggression, attention problems, and then the atypicality was mildly raised. I think that gets raised a lot with kids. It can sometimes ask questions about their imagination or if they're hearing or seeing things, but a lot of times I think that gets mixed in with kids' imagination when they're so young. So I didn't really have any main concerns about that. But this definitely went along with everything mom said, just always on the move, quick to get kind of angry and show some of that aggression. Then the BASC also provides a measure of adaptive behaviors and emotions. And on this side, it's kind of flipped. So we look at scores that are under 40. That might be signs that there's a deficit in one of these adaptive skills. And so just again, across the board, showing that some of his skills were a little bit lower than we might expect given his age. So it's kind of helpful there to have that on multiple measures so that we can see that consistency. Then the last thing we had mom fill out was the brief for preschool age kids. And so this gives us an idea of his executive functioning. And that's kind of his ability to self-monitor, plan and organize his activities or thoughts, the ability to stop himself and think before he does something. And those are all key symptoms of ADHD. So executive functioning is really active in that. And you can see here, again, the T-scores, well, sorry, I was thinking differently there, but based on his percentile ranks and where his T-scores fall, that he's showing higher levels of concern in these areas than most kids his age. So for example, this 86 for inhibit, or kind of that inhibition or ability to stop and think for a moment before you do something, he really struggles with that. And so again, just like mom said, he's on the go, he's on the move, having a hard time taking a breath, stopping and thinking, oh, the last time I hit my sister, I got in trouble, so I'm not going to do that this time. Seems to be hard for him. Shift is kind of talking about moving from one activity to another. So adapting or coping through a change. Emotional control is kind of probably what we see when mom's talking about he gets angry really quickly and has some of those emotional outbursts. And then working memory, so kind of remembering some things as he's doing an activity or keeping things in mind, again, which helps plan and kind of organize your own activities. And it's all sort of scaled and done for kids his age. So of course we wouldn't expect a 4-year-old to be great at any of these things, but the measure takes that into account. And so seeing these high levels, I think, gives us a pretty good idea that he does have some difficulty with some of this organizing and executive functioning, which is probably leading to some of the behaviors that we see.
Kate, before you go to the next slide, I think Kelly had a question in the chat box.
Oh yeah.
It just says, for the brief P, does this mean that children with ADHD have higher or lower amounts of emotional control? I was confused based on him being in the 88th or 99th percentile on the chart.
Yep. Yeah, that's a good question. So it would be that he has less emotional control than his peers, or that we see more difficulty with that emotional control piece. Does that help?
Thanks, Kate. Yeah, I was just a little confused because I feel like when I see like 99th percentile, that means like good, I guess, like it's on the higher end, but it sounds like in this case, it's opposite. Is that correct?
Yeah, so it's more that, yeah, it is confusing the way that's said, but we're seeing less emotional control than most other people.
Thanks for clarifying.
Yeah, good question. Okay, so then I just wanted to note some behavioral things that I saw when he was with me. While I was talking with mom, usually that's a long time. It can be hard for kids, but he did a nice job playing with the toys that we gave him. Saw some make-believe play. He got a little bored towards the end, which is pretty typical of a 4-year-old. Been talking with mom for a long time. He did a nice job of showing mom some of the toys and just being really social with me, with his mom asking us questions. And when we would ask him questions, he would give us answers and socialize with us. So that was really nice. He loved the M&Ms and kind of attention and just the one-on-one time that I spent with him. And so seems like we didn't see a lot of big behaviors, but again, just the environment of getting those M&Ms every time he did something, having me one-on-one to kind of watch and play with him doing our little puzzles, I think was really motivating for him. But I could see where when he doesn't have that, it would be pretty difficult. He was fairly active, kind of moving in his chair, and then towards the end just was again kind of done and really moving around the room. Every once in a while he would need an extra prompt or a reminder or have something said again, just to keep him engaged. And then as he did get tired or frustrated with things, he would kind of just put his head down. I think he was over one of the questions one of the subtests where I'd show him pictures and ask him to point to which one, and he would just put his hand on the whole thing. So I just have to very specifically remind him, point to one. But I think him just hitting it was kind of his way of being like, I'm done, I'm over this, let's move on. So there's a little bit of that, but again, overall was able to re-engage him with reminding him of the prizes or some of the snacks that we had. So just initial impressions, I've kind of talked a little bit about this overall, but cognitively, a little bit of a varying profile based on that weakness in the spatial area, but overall was expected for his age and weren't seeing major concerns there. His learning, both adaptive skills, so those self-help or daily life skills, and then school-related skills were both delayed. So it seems like some kind of challenge or difficulty there and really picking up some of the skills that are around him or that we're wanting him to learn. And then emotions and behaviors, definitely hyperactive, impulsive. Mom did talk a lot about the key emotion. She either sees him happy or angry. So kind of on that end, comes out as irritability or being defiant. And then some of that aggression, which again is mostly aimed at sister whenever he's told no or things don't go his way. So kind of based on what we saw, we're initially thinking he would fit ADHD with both inattention and hyperactivity, and that causing some of his big emotion outbursts, difficulties in learning or picking up skills because he's just moving so fast and having a hard time sitting down and really learning them. And then his emotions and behaviors go right along with that as well. And not seeing any cognitive concerns that might be underlying his behaviors. So that is what we are thinking initially. So yeah, I'm happy to answer questions and see if there's more I can share. Kelly, did you have a question?
Oh no, I was just saying you did a great job and I loved the layout of your presentation.
Thank you. I appreciate
Um,
that. I have a hard time mixing up the clapping and the raising hands.
They are very similar. And I apologize. I do have one thing, and I don't know if you said at the beginning. Was mom the only one that came to the appointment, or was there anyone else?
Yep, he just came with mom.
Thank you.
Kate, can I ask, sometimes I've seen like in your, not your specific reports, but psychology reports, that diagnosis of like other unspecified impulse control, like it's more of a behavioral encompassing or like a prelim ADHD. Are you thinking that like most of the outbursts would really be classified under, like are better described under this impulsivity component to the ADHD? Like, do you feel like that one diagnosis really encompasses most of his struggles?
Yeah, he seems impulsive. I think ADHD does a nice job of capturing sort of the executive functioning piece where just difficulty kind of organizing himself, and that's why we see some of the behaviors.
Yeah.
And then I'd be curious to see what he would look like with some intervention, whether that's medicine or therapy or something like that, and see if he responds to that, I think, before doing any other behavioral diagnosis.
Yeah.
I don't know if other people feel differently.
No, that's a good answer. Thank you for your presentation.
Kate, I had a quick question, and you did an amazing job. You may have already mentioned this, but I was wondering if you were going, I don't know if he's still in preschool or schooling, but if you were going to send like the brief or the BAS to other stakeholders that work with him to kind of get some comparison from moms.
Yes, thank you for asking that, because I definitely forgot. We sent the BASC and the brief to his school, and we got them back. So they're sitting next to me, but they've not been scored yet. So, but yeah, we did. He's in Head Start currently, preschool.
Awesome. Thanks, Kate.
Great presentation, Kate. I have just a little specific question because I wasn't familiar with the term, but in the Bracken, you said, or there was one of the little subtests was position direction, and there was a composite score for position direction. Can you explain that a little bit more? That wasn't really intuitive what that meant.
Yeah, so I'm gonna pull up my notes to make sure I explain it right. So I think I actually may have had, I think the direction position may have been a typo down there and should have been his, let's see what it's called, kind of the summary of those other composites. So the school readiness had shapes, letters, numbers, and more of those concrete things. And then, yeah, so it should have been his kind of a summary of all of the other things that were there. So the direction, position, self and social awareness, texture, materials, quantity, that he did for us. So I had that labeled wrong. So it was basically the composite of the shapes, numbers, and letters, the concrete and colors. And then the second one was directional terms, textures and materials, social self-awareness, and quantities. So thanks for clarifying that, because yeah.
Okay, thank you.
I had a question real quick. When mom says that he has his outbursts, did she mention anything like how she handles them? Does she put him in timeout? Does he stay in timeout, or what they are doing to maybe correct those behaviors in the moment?
Yeah, we did not spend a lot of time talking about that. It seems like sometimes just letting him have his space a little bit to kind of get it out is helpful. And then I think it sounds like a lot of energy too is spent just redirecting, making sure like keeping sister safe, and trying to redirect his attention or something to the next thing.
Can I just add something, Kate? I think when we talked to mom too, she had several times made statements about, like, this works with other kids. It doesn't work with him. Like, she's exhausted all her options, doesn't know what to do. He needs something different and she doesn't know what that is. So I think she's just overwhelmed.
Okay, are there any other questions for Kate? All right, good job, Kate. Next up, we have Shannon from social work is going to share with us what her report.
Okay, yes, let me share my screen here. Can everyone see it?
Yeah, we can see it.
Okay, great. Okay. Sorry. Okay, so just going over the social work assessment tool for Cincinnati Children's. Basically, I just try to get as much information about the family and the patient as possible. Some things that I've added to the assessment tool that I found from last semester that didn't go over it was discipline. So I included discipline in my assessment with mom, just trying to understand like the complete family system. And also another aspect that I added was just having a question regarding any cultural considerations that is not on the children's assessment tool. So as we've kind of gone over, Jonathan is a 4-year-old male and second oldest of his mother's 4 children. He has 4 half siblings from his father's previous marriage and 1 half sister from his mother's previous relationship in high school. She had a child, she told me. And again, he's in for parental concerns regarding behaviors, including outbursts, violent behaviors towards younger siblings, and anger issues, as the mom described to me. So I just like to do a genogram. I don't know if anyone's familiar with this, just to get a better understanding of the family and their picture. So the patient's parents are not married, but they are in a relationship with one another and they live in the same household. That's why this little house is here, to show that they cohabitate with one another. This relationship to the left shows that dad had divorced from a previous relationship, but he had 4 children with that person, and mom had a previous relationship, but it was a breakup, not a marriage. And she has 1 child from that previous relationship, and together they have 3 children. So to our knowledge, mom and dad both have guardianship and consent to treat for the patient. Mom appears to be the primary caregiver and grandma appears to be mom's primary support system. Prior to living with the patient's father, the mother lived with the patient's maternal grandmother and grandpa for a little bit. And I will get into that a little later. So the school district that the patient lives in, the district is called Gallatin County Public Schools. He's currently attending Early Head Start for 4 days a week. So he goes Monday through Thursday, and mom provided contact for information for the school manager. So I called her on Friday after I met with mom on Tuesday. And the patient's siblings go to daycare 5 days a week, and the patient has an IEP for speech. So when I called the teacher on Friday. She talked to me for about an hour, going into a lot of information about the patient and the patient's history with school. So he has been going to early Head Start since the preschool, since he was about 8 weeks old. The teacher has known him that long. She was a teacher, and then she moved up and became a school manager, but still kind of does it all with the lack of staff with COVID and things like that. So she's very familiar with the patient and knows a lot of his history. She said that he is receiving speech services at school, and he also goes to a behavioral therapist at school. And basically the early Head Start teachers are very involved in his care. They're very passionate about working with him and recognizing that he has additional needs in the classrooms. One of the barriers that the teacher talked about, or the school manager talked about, is that there are a lot of, the family really struggles with attendance. So they may go 2 out of 4 days a week or 1 out of 4 days a week. So some days he'll miss that speech or behavioral therapy. And so it's not consistent, which is hard. And the teachers have found that he's his best when he's going to school 4 days a week. And in that environment, the teacher also said, or the school manager also said, that he, she thinks from her observations and her knowledge that there isn't a really great routine at home. So when he comes to school, he has a really positive routine, even if, they have to redirect him at times and have to, they use conscious discipline. So she's we don't really yell at the kids, but we have a cozy corner, as she called it, where they give different tools and interventions to help the kids calm down. That he does his best in those environments, but because school is inconsistent, there is a struggle there. Another piece of information that she let me know about was he did have a brace on his first foot at one point in time. She said his left foot, and she said his left foot is turned out a little bit, and that he often trips, which is a safety concern for her. So they have to be pretty careful, because sometimes he can be as she described, a runner. And he is often running all over the place and tripping over himself. So that's a concern that she has. Additional family history that she mentioned is that mom did have a restraining order against dad due to domestic violence about 3 years ago. So dad did not have access to the 2 children while they were at school. And so that's why the school has that information, because they received paperwork regarding that dad wasn't allowed to pick the children up under any circumstances. And because of this, he went to parenting classes and has since those restraining orders have been dropped as mom and dad are back together. And this is something that maternal grandma does not approve of. And so she, who was a primary caregiver in the patient's life, has she doesn't offer as many, she doesn't offer to watch him as often, because she doesn't really approve of the relationship. And also she is not able to watch him with the behaviors that he has. Other educational concerns is that the school manager mentioned that after this year, he will be going to preschool, and in their county, preschool is only 2 days a week due to busing and transportation issues. And she's really worried that by him going to school only 2 days a week, that because of the inconsistency that they see now, that it could only be 1 day a week. And that she's just very concerned about his development moving forward, just because of the inconsistency with school. And the reason, and I can kind of get into this, but in my later slides, but one of the reasons that there is an inconsistency with school, she said, is because dad's in charge of school drop off because mom's working. To our knowledge, and mom disclosed this too, that dad doesn't work. So he's in charge of kind of getting the kids ready in the morning, getting them to school. And so there isn't a super great routine there. And so that's something that the school manager brought up.
Shannon, Nicoletta asked, do you know if preschool is half day or full day?
It's 2 full days. So it used to be 4 half days. And then with transportation issues, they had to split up the county, and now it's just 2 days a week. So it kind of depends on where you live.
His current school for his Head Start, is it full or half day?
His current school, it sounded like it's like 8 to 2:30. So I don't really know what that is, because they feed the kids lunch and they go home around 2:33. So it's pretty, so the reason why Head Start, I asked her, I was like, how can you guys have almost 4 days a week? And she said that they told the parents, like, if they could get the kids to the school, that they'll teach them. So they are disregarding kind of county policy and just going ahead. And if you can transport your kid and get them to school, then that is what they're doing. So in terms of like social emotional supports, mom report that they have a very close family system, even though maternal grandmother and grandpa don't watch the patient as much any longer. They do spend a lot of time together. And they also spend time with the paternal grandmother and her boyfriend. When she's not working, so mom works as a CNA. She's at a hospital down there, or like a healthcare center down there. And she told me that like when the behaviors got really bad, a lot of it was like during the summer. So like Head Start ends in May. And so she went back to, she was taking him to like Kings Island every day to like get his energy out, because she didn't know how to deal with his behaviors. And when I asked the teacher about this, I was like, was he missing classes to go to Kings Island? She said, not that she knows of, but like it makes sense because it was happening a lot during the summer. But she said that was definitely a safety concern, basically because he trips so often when he walks. And then just like when I asked mom, like how's she doing with the patient's behaviors? She just said it's like really stressful, and like she felt really overwhelmed, and like she did something wrong. And I affirmed her that, of course that's, she didn't do anything wrong, and she's doing her best just by showing up to children's, and that's really important. So just trying to affirm everything that she's doing for her child, and the patient is very positive. So some of the barriers to treatment is obviously the distance. It's a long way, but they are committed to coming, and they've been really great about just corresponding with MARTA, even just like letting us know if they're running late or anything like that. Mom's been really great about that. In terms of finances, they utilize Kentucky Medicaid. They also utilize SNAP and WIC, and I believe mom said that dad is receiving SSI. I also offered that we could provide them with some food to go home, and they accepted that. So that was great. Mom did report that they don't really have any community support system other than early Head Start. And when I talked to the school manager, she was telling me how like mom was like, when the patient was accepted, or we chose him to be part of like the ITT case, that she was just like really excited about it, and was just like, really like the school manager was just like, it was really great to hear from mom that she's like so excited to get him the care he needs. But they definitely do not have a lot of resources down there. And when I asked where they go to utilize like any just like pediatric care, she said Pediatrics of Florence, or Pediatricians of Florence. And so I was curious if they're driving all the way up to Florence, Kentucky. I don't know if there's one closer to where they live. As I said, mom works full time, and she's the only working parent in the home. And then just additional considerations. So, mom just reports issues with the patient's aggressive behaviors towards his siblings. She says he can be like really aggressive at times, and she doesn't feel safe to like leave the siblings alone with him. Like if they're all in one room, she tries not to leave them alone. She says that the patient has difficulty with sleeping, and he was prescribed 10 milligrams of melatonin, and that the patient also sleeps in bed with mom, and says this disturbs her sleep. And that like, it's really just hard to get him to go to sleep. And when I asked about discipline, so mom says she's following methods. So she will, when he's acting out, she'll put him alone in a room. Sometimes she'll yell at him, and reports that the father is a bit tougher on the patient than the mother is, and like can yell as a form of discipline. when I talked to the school manager, she said that she reported that the father is okay with some of the behaviors and like the more difficult behaviors, and even tells the patient that it's okay. And she said that the father views it as like boys being boys. So she said it's kind of difficult when like some of the behaviors are pretty difficult and like there isn't a lot of discipline in that sense if the father like approves of it. As I said, the primary caregiver is the patient's mother. She, appears to have a really strong attachment and cares a lot about her child, and just trying to figure out what they can do to best help him in some of the behaviors he has. In terms of a family history, and I think this went, this might have already been gone over, but mom reports that she has ADD and ADHD, as well as the father has an ADHD diagnosis. And then she also reported that the patient's father has an autism spectrum disorder diagnosis. So she said that wasn't for sure, so I'm not completely sure, but those are the things that she mentioned to me. And that mom reports a history of autism spectrum disorder on both sides, and says that some of the patient's cousins have ASD, and that both uncles on both sides of the family have ASD. And that's it for me.
Any questions for Shannon?
Shannon, that was an awesome presentation. You got a lot of great information. Can you, I'm sure I missed it, but I know there were some half siblings. Are some of them out of the home? How many live in the home?
So the sibling, so he lives with all of his, so he lives with his two sisters that are from the mother, both the mother and father, like they're both their children. And then there are 4 half siblings from the father, and there's 1 half sibling from the mother. And so the 4 half siblings live with their mom, but visit every other weekend. And then the daughter of the mother, of the patient's mother, lives with maternal grandma, because she basically from what I learned from the school manager, she basically raised that daughter, the maternal grandmother did. So she's about 8, and the maternal grandmother, or the school manager, also said that the 8-year-old sister also struggled with speech and had some speech therapy, but was like pretty on target developmentally. So.
I just had a quick question about kind of relating to family dynamics in a way. I know you said the history of the restraining order against dad and that he did take some classes. Did you know anything if like the restraining order was caused due to challenges between mom and dad, or if it was dad and kids, or anything like that?
I believe it was between mom and dad, and it was like, from what the school manager told me, and it is very sensitive, so I don't know the details of it. And the school manager, and I told her like, this isn't information that I would be like, going and telling the patient, and not the patient, but like the patient's mother, and inquiring about it unless we saw serious concerns. But apparently it was an event. But I also asked the school manager, I was like, do you have current concerns for safety? And she said no. And so like, I have to go off that, because these kids are coming to school every day. But also she said something that's challenging with Early Head Start is that before COVID, they used to do home visits, and now they're not doing home visits because they're just so short-staffed. And I did ask mom, part of my assessment is asking mom if there's any concerns for domestic violence or neglect and abuse in the home. And mom said no. So, I mean, if she reached out for resources the first time, I hope that she would feel if there were any safety concerns, she would feel comfortable talking to us. But that's all I got from the school manager.
Thanks.
I want to add real quick. It does concern me. So what the legal term for the restraining order is a temporary protection order, or a TPO. It does concern me a bit that the kids were named. Typically, we're going to find that it just has mom. Like if it's a domestic violence, typically a TPO only names the person who was hurt. And that, so like if you're in those situations, dad hurts mom, but he still can see the kids, but dad and mom can't communicate, which is complicated in itself. Normally, a TPO doesn't include the children unless the children were thought to be at risk of harm. So either they were harmed or they were at risk of harm more than like dad came home and beat mom up. Domestic violence is still child abuse. So it is interesting to me that like the TPO said, dad can't pick the kids up. That makes me a little concerned that there might have been some involvement with the kids. And that he must have worked a case plan because then he went to parenting classes and now he's back. So he probably had a children's services case that involved parenting classes for how to manage your anger, which is usually when you're angry with your children. And then TPOs expire. They always have an end date on them unless you go back to court and you have new evidence to continue a TPO. It's temporary. It's really hard to get like a permanent protection order. And so these expire typically during your course of your work with children's services.
Yeah, from my talking with the school manager, she is not a fan of dad. And she really tried not to be, at first she was like really tried to be unbiased about it. And then she was just like, yeah, he really does not commit to routine and she's the only one working. So it's just like a struggle, but also like maternal grandmother doesn't approve of the relationship and she was the primary caregiver before. So that is also a struggle. Yes, very difficult. And I think, Megan, so Marta and I did talk about that, like in terms of like if some of the behaviors are because of the trauma. And I asked the school manager what the patient's relationship was like with the father, and she said it was pretty positive. Like when he's in school, he talks a lot about his dad and like doing stuff with his dad. But this teacher or the school manager, sorry, same name. If I say teacher, it's also school manager. But she was also saying how like he encourages behaviors like spitting. Like at school, he was like having a behavior of spitting, and the teachers try to say like, that's not okay. And he would be like, well, my dad says it's okay. So there definitely is some inconsistencies with like what he's learning at school and like what he's learning at home, and then mom working a lot too, I think.
Thanks, Shannon.
The teacher also said like it would be great if we could get dad to come to an appointment. I know, Kim, you asked, will mom be the main person bringing him? And I think she will be. But the school manager would be like, maybe you could like encourage him to come to an appointment. And I have not talked to Marta or the patient's mom about that yet, or what that would look like. And I'm guessing that he provides childcare for the other two children when she comes up to Cincinnati.
Do you know how long they've lived, like since when they moved in with mom and dad?
Yes. So the school manager said that it was about, I think this all happened like maybe 4 or 5 years ago, like when the restraining order first happened. And then 3 years ago, or maybe even like 2.5, they moved back in together. And they moved out of maternal grandma's house. But like the school manager said, when they lived with maternal grandmother, it was like a very consistent environment, like consistent routine, positive. Like the kids were all coming to school. I think like one strength to mention though, is that like the school manager was saying like how they are like dedicated to his learning. And it just made me feel like so confident. Like these teachers are struggling so much. There's not a lot of people that want to be working right now in school conditions. And like, I just affirmed her. I'm like, what you're doing is so great. And like, even though this kid has difficult behaviors at times, like it's so wonderful to hear that you just care so much about, this one child. So
You mentioned that the school manager thought that the reason why the attendance was poor was because of like lack of routine. Is that what you said?
Yes.
But it would seem like that might, be more like they were showing up late or something, but they don't come at all half the time.
So yeah, she said that they don't like, it's been pretty bad recently. They will come like 2 or 3 days, or like, and the younger siblings can go 5 days. So she said that's like just a struggle too. So yeah, they come like 2 or 3 days, but like he won't, he'll miss speech. And she also mentioned about the brace for his foot, that like he got fitted for a brace right before COVID happened. And then it wasn't consistently used at home. So she doesn't think it was like ever used. And so like the problem has just gotten bigger in terms of his tripping issue.
Mom will be at all of the appointments. She told me right away, she took all of these Tuesdays off of work to be there. So I think we will definitely see Mom. Yes, we will encourage Dad to come to at least the ISS with her. Maybe Grandma too.
And Dr. Razor Becker, yes, I did get a very empathetic vibe from the school manager. She is very appropriate. She really tries to do as much as she can for the family. So even if it's like sitting with the patient at lunch, because she said he's pretty good with the other kids sometimes, but he's really he likes to do things his way, and he wants other kids to do things his way. And when they don't engage with him is when he kind of starts acting out. And then when he gets to a point where he works himself up so much, they just know that he needs a quiet space for himself, because he just gets way too overstimulated and overwhelmed. I did ask how his performance is in school, and she said that he definitely does struggle. And even when I met with them, I asked him to draw a picture of his family, because I'm in a child mental health class right now, and I'm supposed to do an intervention with the patient every week. And he didn't really know, he really struggled with picking up the crayon, knowing who was in his family, kind of how to draw a picture in general. And I went back and reflected, I probably should have just asked him to draw a picture of himself and see where that went. But just something to keep in mind for the next evaluation.
Pat asked a couple questions in the chat box. Can you see them?
So Pat, I think Mom has she has her CNA is what she told me. So I would assume she has some type of technical degree. I don't believe Dad, maybe high school, but I asked if Dad worked to Mom, and Mom said not right now, but he does she said something about him being a contractor potentially, or doing his own business or something like that. And there are no religious beliefs that influence the work of the patient. I did ask if they belong to any type of religious system, and she said no.
Does anybody else have any questions for Shannon? Great job, Shannon. Okay, today we only have those 2 disciplines to present. So the next ITT meeting is February 22nd, and I believe there are 6 disciplines going. So that meeting will be jam-packed. So if nobody has any other questions or comments, we are done for the day. So you can enjoy your hour off early.
Yeah, great job today, guys. Both of your presentations were very nice, and you continue to impress us with your great questions too. Thank you.
Are we going to do breakouts?
Oh yeah.